Good afternoon, students. I'm Donna Ernst, and I'm going to be presenting your very first nursing skill as first-year nursing students. So today we're going to learn hand hygiene. So first of all, I want to give you a little background as your very first nursing students. In the United States, hospital patients get nearly 2 million infections a year. That's about one infection every 20 patients. Infections that patients get in the hospital can be life-threatening and hard to treat. Hand hygiene is one of the most important ways to prevent infections. Healthcare providers should practice hand hygiene at key points of time to disrupt the transmission of microorganisms to patients. This is before patient contact, after contact with blood and body fluids, and contaminated surfaces, even if gloves are worn, before invasive procedures, and after removing gloves. It's not good enough to wear gloves to prevent transmission of pathogens in healthcare settings. Patients and their loved ones play a key role in preventing health infections by practicing hand hygiene themselves. So today what I'm going to do is I'm going to show you two ways to do your hand hygiene. The first way is the hand wash with our soap and our water. The second way will be your hand rub. So first we're going to do how to do hand hygiene. This is from the CDC, it's the Center for Disease Control, and this is through the World Health Organization. So the first thing, step 10, is turning on the water. We're going to turn on the water. Step 1 is getting soap. Step 2, we're going to do a circular rub with your hands. Step 3, we're going to do your fingers. Step 4 is fingers again. You want to get in between all, down where they meet, palm to palm. Step 5, you're going to the back of your fingers in opposite palms. Step 6 is your thumbs. We're going to work our thumbs. Step 7 is rotating backwards in your palms. We're going to do that. And then we're going to rinse our hands is step 8. Step 9 is we're going to dry our hands, and we're going to use a paper towel to shut off the faucet. So that's the first. Then we'll have clean, safe hands. Now to do a hand rub, we're going to take our bottle of hand cleaner. We're going to squirt some in our hand. We're going to rub the palms. We're going to rub between our fingers. We're going to do fingers into palms, our thumbs again, inside our palms, and all of the hand rub should pretty much absorbed in your hands. So I'm going to do it first, and then I'm going to ask for a return demonstration. Who would like to be my student to return? Okay, come on up. And what's your name?
Kim.
Okay, so first thing we're going to do is we're going to walk up to our sink, and we're going to turn on our faucet. I will turn on both this time. Okay, we're going to go ahead and get some soap. Okay, we're going to start rubbing in a circular motion in our palms, both sides. We're going to get in here between the fingers. We're going to make sure we get back of the hands, the fingers. We're going to do this motion to get in there and get our palms real well with our fingers. Okay. We're going to do inside of our palms, inside of our palms. We're going to do our thumbs, back of the hands. You can go up to your forearms a little bit. Okay. And finally, we're going to go ahead and rinse our hands off. And downward, make sure all these down. Now we're going to get some paper towel. We're going to dry our hands really, really well. I'm going to take a last paper towel, and I'm going to turn off my faucet and throw it away. Now my hands are safe to touch a patient.
Okay.
Now are you ready to try?
I think so.
Okay.
Turn on my water. Okay. Put together in a circular motion. Between the fingers. Backs. Reverse. Thumb.
do you want to demonstrate the hand rub? Okay.
For the motion. Between your fingers. Okay.
Very good. Thank you for volunteering. Do any of your students have any questions? Nope. Yes?
Is there a preference on soap?
No, there's not a preference. Usually at a facility, a hospital facility, a lot of nurses use the hand rub just because of convenience. They say throughout the day you should wash your hands. If you're in a very contaminated area or with patients that are very contaminated, soap and water is best.
Can I always use the alcohol rub instead of washing?
No, you must use the hand hygiene with certain types of bacteria like C. difficile. And when you go to your facilities, they will teach you some of those. And as we move forward with the classes, we'll explain some of that to you so you're educated. But there's certain disease processes that you do have to use soap and water. Okay, well that's it for my demonstration, my active learning strategy today on hand hygiene. Thank you.
Thank you.